This is the project implementation phase 3, step 3, new technical skills required by clinicians and administrative staff. HIMS 670, Health Informatics Administration's capstone. The agenda is going to be the background, purpose, then discuss the required technical skills for clinicians, doctors, and nurses, administrative staff, specifically scheduling and medical billing, then the conclusion.
There were 3 phases to this implementation. Phase 1 was initiation and planning, phase 2 the execution and closing, and phase 3 is the change management. In HIMS 650, we completed phase 1 initiated and planning. We delivered the description of an existing paper-based medical record system. We identified the stakeholders, project team, and project manager. We developed a EHR implementation plan. We planned for the resource requirements, human resources, finance, and project management software. Then we looked at change management plan. In HIMS 661, we completed phase 2 of the execution and closing of the project and delivered the work breakdown structures, the system acquisition, including RFIs and RFPs, provided the EHR implementation schedule using a Gantt, outlined a communication plan with the stakeholders and team members, laid out the monitor and controlling with scope, tree, time, task, budget, and quality, outlined and executed the testing, the unit and integrated performance system testing, and then the closing and signing off of the project completion. And we're here at HIMS 670, and we're developing phase 3, the change management plan. It's a 6-step process, and we're to consult with relevant resources for each step and guidance.
The purpose is to discuss the third of 6 post-implementation steps. It consists of technical skills required by both categories of users, both clinicians and administrative staff. Going to talk about computer use, keyboard skills and typing, data entry skills, multitasking, specifically interacting with patients while using EHR, workflow fluency adoption, EHR navigation, and electronic communications using email and messaging. For computer use, digital technology has been integrated into almost all areas of healthcare electronics record keeping for a while. According to the American Hospital Association, between 2009 and 2015, hospitals using EMR systems went from 12.5% to over 83%. And then by 2017, it had increased to 96%. Computer use for digital healthcare involves electronic medical records, medical billing and coding, healthcare scheduling apps. The basics of electronic medical record keeping require knowledge of different types of components, including software, how to log the information digitally, how to sign it digitally, use of the tools, including the tablets, the RFID scanners, and the patient's medical records, and a variety of other things to help you use the records efficiently. Another type of skill for computer use for digital healthcare is medical billing and coding. This requires and uses thousands of symbols, the alphanumeric symbols, that have been assigned to different diagnosis, treatment, and tests, and is used throughout the billing cycle. Many insurance companies' policies require everything to be accurate and correct. The use of medical coding software really helps determine the correct codes and make sure they're paired correctly. And knowledge of this administration process as well as the technology is crucial to running an efficient operation. The other computer use for digital healthcare is healthcare scheduling apps. There's a large variety that are available, And the scheduling is for the practices, clinics, or hospitals. And the point of it is to uh, schedule appointments for all the physicians and the procedures for larger clinics and hospitals. The next area is data entry. In EHR processing, physicians and nurses are always encouraged to perform the medical charting procedures as close to the payment as possible. There are 4 areas of concern. We want to prevent errors. We want to improve decision making in the patient care process. We want to lower the overall costs and improve compliance. Delays in data entry can lead to errors in the medical record. The wider the gap between the health events and the counters, the greater the data disparity will be. This will lead to incorrect handoff communications and impact the outcomes. Real-time data will not be available. Patients' results will not be available, and diagnosis will be slow to happen. It's important that the information is put in and the data errors are prevented. Timely data entry is also important as it improves decision making in patient care. Real-time data enables clinicians to make proper decisions based on comprehensive information. The real-time data entry ensures the timely recording of the clinical data will help make the staff make the right decisions and implement innovations before the patient state becomes altered or critical. Timely data entry goes without saying lowers your overall costs. Manual data entry can lead to errors that increase overall administrative costs. EHR can automate as much as possible passing information to and from different systems, as well as other devices, reducing the chance of error, reducing the amount of cost it takes to correct those errors. Also, as part of timely data entry is the ability to improve compliance to clinical protocols. When the data is entered real time or close to real time, clinicians can get a complete view of the patient's past history and present illness as well as other information. This allows the clinicians to make correct decisions based on information presented to them in a timely manner. The next item is referred to as multitasking. In essence, it's having a clinician using the EHR while in the presence of a patient. Now, research from Ratana Wongsa noted that the use of electronic health record systems with a clinician with a patient has a chance of making errors, creates patient dissatisfaction because it's quiet as the clinician tries to enter the information in. If the clinician decides to not deliver the more interactive level of service with the patient and delays it, it will provide a higher level of burnout and stress. According to Jason, clinician burnout impacts up to 80.5% of the clinicians, and on an average, 44% of the clinicians experience burnout. There are different ways and different strategies to reduce multitasking. EHR system misses. One of the strategies is to have clinician transparency when needing to have silence on EHR systems. An example is for prescribing. An alternate strategy is narrating EHR system into a voice capturing device. In addition, patient activation during an ESR system use. Other practical areas are adapting visit organizations and workflows, improving the EHR system design, and improving team support and systems. The next item is workflow fluency adoption. Now, a critical step in the process of the EHR adoption, allowing both the clinicians in this different areas to specialize in their workflows and map their skills to the maximum benefit of the technology. Essentially what happens is the EHR is a one-size-fits-all, and the specialty and care teams have different workflows. So the key here is to align these care and specialty teams for the delivery of patient care. What that does is properly and enable the care team members to do their job, increase the competency, and also complete the efficiency. The next technical skill we're talking about is EHR navigation. There are some adoption concerns in this area, and it contains persistent problems with respect to the not mapping of the workflows that are relevant to the clinicians. Sometimes the EHRs are unnecessarily complex and confusing. So the areas of concern are just the problems with the interface design, and the workflow doesn't map into the specialty teams, as well as the assessments where the workflows and or the the screens themselves were not reviewed by experts or users and implemented. According to Duncan, navigational complexity has undeniable impact on the burden experienced by clinicians, and there's a huge gap in the usability of issues with respect to the design that impacts the cognitive performance, expert-based and user-based methods. The next item is electronic communication revolving around emailing and messaging. Now, as of 2020, according to Dries, 47% of the individuals use messaging with EHR, including text messaging and emailing, with their healthcare providers. Recent surveys have looked at 31% of the patients use EHR messaging system, 24% used emails, and then 80% used text. Now, this is a great tool. One of the things we have to be concerned about is the HIPAA compliance, and to understand what the barrier is for the electronic communication practice. With all the computer skill requirements between the physicians and medical and billing staff and scheduling staff, it all predicates on one thing: the basic medical computer skills are there. Everything, it's a foundation to operate and perform an EHR. And after 40 years of being in this world with the computers, it's still amazing to see that there are people that aren't computer literate. So how we would approach this, we would put together a training program from the very beginning of creating the EHR. So the best way to keep training or keep the physicians and clinicians and scheduling and medical billing staff moving forward with the computer skills is to have a vigorous training program that begins at the very beginning of the project. There needs to be a culture of training within the organization that needs to be supported through all stakeholders of all levels. And it needs to be known that the EHR knowledge base and refinement will be the key to success. The success will consist of initial training, consists of developing teams of super users to support each department. These ESR trainings are short and comprehensive. The training is also closely scheduled to the point of need, very specific to the hospital staff. And the training is iterative and continuous improvements with best practices are applied. Thank you for watching this video. The next 10 seconds will be the references. Thank you.